The big COVID-19 question right now is, where did the virus originate? Well, Dr. Fauci recently said he was not convinced the virus was natural, suggesting it could be man-made. But just days ago, he seemed to sway the other way. Listen.
It is more likely that this is a natural occurrence, as has happened with SARS-CoV-1, where it goes from an animal reservoir to a human. But we don't know 100% the answer to that. And since this is a question that keeps being asked, we feel strongly, all of us, that we should continue with the investigation and go to the next phase of the investigation that the WHO has done.
Well, our medical expert, there she is, Dr. Payal Kohli, joining us live. Hey, Dr. Kohli. So what does the science tell us about the origin of this virus?
So you guys, the science tells us that the SARS-CoV-1 virus, as Dr. Fauci said, and also the MERS virus, which are both cousin viruses of the SARS-CoV-2 virus, originated naturally. They originated from bats, and they had an intermediate animal, and that's what we think happened with this one. Because if you look at the genetic code of this virus, that's what seems most plausible. Now, what really raised this question all over again a year into the pandemic is the fact that we just found out a few weeks ago that 3 workers in the lab of virology in Wuhan all became sick and hospitalized in November 2019, just before the pandemic hit globally. Now, we don't yet know what they were sick with, but this really starts to ask the question of whether this virus may have been present in that lab. But in terms of how it evolved, it's very plausible that it evolved naturally, not necessarily man-made.
Dr. Kohli, I'm going to go off script here for a little bit, because I've heard, and I don't want to get into conspiracy theories here, that not 1 but 2 different labs in Wuhan were studying this very same virus. I know you just explained that it wasn't that, but how do you explain that 2 labs were working on the very virus where this came from?
You know, Jeff, it's a little tricky, because we do know that cousin viruses like SARS-CoV-1 and MERS, which have a lot of homology, what we call overlap genetically, are very similar. So it's really hard to know if they were studying those viruses that just sort of evolved and mutated into this one, or whether there was some sort of intention in actually creating a mutation and potentially using it, you know, as the conspiracy theory says, as a biological weapon. So I think it's important to get the information. I'm really glad that we're doing the investigation, because that's really how we're going to answer this question definitively. But at the same time, it is very plausible that it could have all happened by nature, just like it did with COVID-1 and MERS.
Well, Dr. Kohli, obviously this weekend's Memorial Day weekend. An estimated 37 million people are expected to travel. So I know a lot of people have some anxiety around it. Is there anything you'd like to remind our DBL Nation about if they're deciding to travel this weekend?
Well, first of all, I have to say I'm super excited for the weekend. I hope you guys are too, because if you're fully vaccinated, this really is a chance to let your hair down and have some fun and do some get-togethers. But if you are going to travel, keep something in mind, that even if you're fully vaccinated, you have to wear that mask, and you should wear that mask in public places like airplanes, public transportation, at the airport, because you have to protect yourself. We are seeing some breakthrough rates of infection occurring, and when lots of people congregate in a small space, that's when the virus can spread. I also want to make sure we're really attentive to our kids who are in that transition phase right now. If they're over 12, maybe all of them are not fully vaccinated. And if they're under 12, they absolutely have to keep that mask up. So even though we can relax a little bit, I do think it's important, if you're going somewhere in a public place, to make sure you're careful.
Thank you so much, Dr. Kohli, as always.